The grim news continues to pour in as far as the fight against coronavirus is concerned. Every day we're seeing a new single-day record being reported in the country. And again, we have bad news for you as far as the coronavirus cases are concerned. Over 2 lakh cases for the second straight day being reported in the country. India has logged in a record 2,17,353 daily coronavirus cases as many states grappled with shortage of hospital beds, oxygen, medicines and vaccine doses. The fresh cases in the deadly second wave took the total caseload to over 1.42 crore. The positivity rate in the country has gone up. It now stands at 14.4%. Let's also break down the data for you further. Let's focus first on the capital, Delhi. For the 5th consecutive day, over 10,000 cases being reported now in the national capital. But there's been a slight decline if you look at the numbers that have come in the last 24 hours. Earlier, it was over 17,000. It's gone slightly below that. So nothing to rejoice or celebrate. It's now at about 16,000 cases. The state has recorded 16,699 fresh cases in the last 24 hours with 112 deaths, which is the highest since 23rd November last year. With the spurt in cases, Delhi's positivity rate stands at an all-time high. That's 20.22%. The Delhi LG, the Lieutenant Governor, will be holding a review enforcement meet with the MCD commissioners today, adding further to the capital's COVID woes. As many as 388 Delhi police personnel have tested positive. Amid the rising cases, Delhi Chief Minister Arvind Kejriwal has imposed a weekend curfew that begins from 10 p.m. today, goes on till 6 on Monday morning. Only essential services will be allowed to remain operational, while hotels, spas and gyms will remain closed. People who are scheduled to attend weddings will be given e-passes for movement during the curfew. As cases continue to soar in the national capital, the Delhi government has tightened the noose around the violators. Over 2,400 people have been booked for violating a night curfew norm on Thursday.
Here are some of those frequently asked questions answered on Delhi's relock. Can one travel during the weekend lockdown? Yes, you can, but only for essential purposes. A police might just stop you and question you as well. Can a person buy groceries? Absolutely yes, you can buy groceries. Is eating at restaurants allowed? Absolutely not. Only home delivery allowed. Will cinemas be functional? Of course, during the weekends, cinemas will be shut. During the weekdays, only 30% capacity in cinema halls. Are malls open? All malls will be closed until the 30th of April. Can a person order from e-commerce site? Only essential goods that you can order on e-commerce site as well. And finally, can you go to a gym or a spa? Not, because it will be shut until the 30th of April.
And let's tell you what the situation is in different parts of the country. Our reporters from the different cities have filed these reports.
COVID situation in Mumbai continues to remain grim. The count of active sealed buildings in Mumbai now stands at 1,100. The count of containment zones now stands at 95. The active cases in Mumbai are more than 85,000. And the biggest problem being encountered by the officials and administrators in Mumbai is the need for medical oxygen. BMC has now appointed 6 officers that will coordinate the supply of the available oxygen to the various hospitals. At the same time, more than 60 nursing homes will also be given the training as to how to use the available oxygen in an economical and judicious fashion. But amidst all this crisis, the good news for Mumbai and Maharashtra is that the central government has now given Mumbai-based Hafkin Institute the permission to manufacture and produce Bharat Biotech's Covaxin on transfer of technology basis. But the overall condition in the financial capital remains very grim. With camera person Mahesh More, this is Pankaj Upadhyay in Mumbai, reporting for India Today. Karnataka yesterday recorded the highest number of cases, over 14,000 cases recorded, and this is the highest since Jan 2021 is what we are told. Bengaluru alone has recorded more than 10,000 cases. So the government has now called an emergency meeting at 9:30 this morning, and I'm coming to you from the health minister's house here, residence, and he also visited private hospitals yesterday to take a status check as to how many beds have the private hospitals allocated. 50% is the number that the government has told the private hospitals to make sure it's mandatory to give to the patients who come out here. Karnataka also has called an all-party meeting on the April 18th, 4 p.m. to see the opposition's opinion and then take up further action. The sources within the government are saying this, that the government is contemplating on weekend lockdown, just say the same way that Delhi and Rajasthan has implemented. Karnataka too, there's all chances that this might be implemented is what we are told. But however, an emergency meeting has been called now, and there's election also in Karnataka tomorrow. 3 by-elections in Karnataka. Till now, the chief minister and other ministers were all in the constituency campaigning, but now the COVID numbers are on the rise, and health minister too has taken a status check from the hospitals and from the control room yesterday. 14,000 odd cases in Karnataka, 10,000 odd cases in Bengaluru, and it's a high time that the government acts is what the people on ground are believing, and hence 18th is the all-party meeting. We'll have to wait and watch if some big curbs is coming in the way to Karnataka. Nagarjun Dwarkanath for India Today.
The second wave of COVID-19 had worsened the situation in Uttar Pradesh, with 22,439 active cases found in last 24 hours. The total tally of active cases in Uttar Pradesh has gone up to 1,29,000, and as far as deaths are concerned, 104 deaths have been recorded in 24 hours, with the total number of 9,400 in Uttar Pradesh. Certainly it's a big challenge for the government to control the virus spread in the state. For that, the night curfew timings have been increased from 8 p.m. to morning 7 p.m. a.m. At the same time, school and colleges have been closed, and the UP board exams have been postponed for the next date. Also, on the other hand, the situation in hospitals is very critical. Lack of beds, and at the same time, testing, which the government is claiming to have maximized by the day, is not evident on the ground. Certainly, in the coming days, as the numbers are increasing, it's going to be a serious situation in UP, with the infection getting the widespread in the state in last few days. In Lucknow, with cameraman Harish Kantpal, Abhishek Mishra for India Today.
For the last several days, on a daily basis, more than 5,000 cases of coronavirus were being reported out of Rajasthan, and the numbers at the various testing centers have also gone up. You can see at this CMHO center, the number of people who have turned up for getting themselves tested. There is a huge line which is currently there to ensure that the testing can get done. And there have been several complaints also of people mentioning that there have been delays of more than 72 to 96 hours of people test reports being given to them.
जो हम सैंपल भेजते हैं वहाँ कोई मशीन की प्रॉब्लम भी हो जाती है कई बार, तो मोस्टली तो टाइम पे आ जाते हैं, 24 आवर्स में ही आता है, कभी कभी लेट हो जाता है।
तो टेस्टिंग जो बड़ी है उसकी वो भी कारण है क्या?
वो भी कारण है, पहले से प्रेशर ज्यादा है। ड्यूटी टाइम तो यही था, लेकिन पहले 5 से 5:30 तक फ्री होते थे, अब तो 7-8 ही बजते हैं।
That the reports of coronavirus tests come timely and if needed, so that people can get the required treatment in time, so that the spread of the virus can be limited. With Nikhil Sharma, Devankur Vadhavan in Jaipur, India Today.
Let's focus on the state of Uttar Pradesh. Since the onset of the pandemic, Uttar Pradesh has now recorded its highest single-day surge with 20,510 cases. The situation is very grim in the state. It's unfortunate, really. You see how hospitals are overburdened, cremation grounds are also. The bodies of patients is lining up and is really building up with no space whatsoever at these crematoriums. The Yogi government has now decided to ramp up their measures to contain the spread of the virus. So what they've done is night curfew in several districts. They've extended the hours of that curfew.
Uttar Pradesh witnesses biggest ever coronavirus spike since the pandemic outbreak. Over 22,000 cases in a day reported in one of India's largest and most populous states. The Yogi Adityanath government imposes stern measures to check the surge. Schools across the state are shut till May the 15th. Night curfew is extended in 10 districts, including Lucknow, Noida and Ghaziabad. After complaints of hospitals running short of beds, the situation at crematoriums has revealed the true extent of the crisis. This is Lucknow's Vaikunth Dham cremation ground, where a row of pyres are burning, a heart-wrenching sight.
लखनऊ के बैकुंठ धाम का ये अंदरूनी हिस्सा है जहां पर आमतौर पर कभी डेड बॉडीज नहीं जलाई गई, क्योंकि इसके लिए बाकायदा शेड बनाए गए हैं। वहां पर अपनी बारी आने के बाद डेड बॉडीज जलाई जाती थी। लेकिन अभी हालात ये है कि यहाँ सड़क पर जो अंदर रास्ते बने हैं, जो छोटी छोटी जगह खुली पड़ी हैं, वहां पर डेड बॉडीज का क्रेमेशन करना पड़ रहा है, क्योंकि संख्या बहुत ज्यादा है।
There has been an unprecedented increase in cremations. So much so that Lucknow Municipal Corporation has increased the platforms for cremations. The authorities have also brought in additional wood to cope with the constant influx of dead bodies.
17,000 रुपए दिए हैं फुल पैकेज का। अब ये सही है कि गलत? मुझे
पैकेज क्या
मतलब लकड़ी, हाँ पैकेज, उसमें सब व्यवस्था लकड़ी और जितना यहाँ पर घूसखोरी का भी है, सारा पैसा है।
What exposes the stark reality is the discrepancy between the figures given by the managers of cremation ground and the government. According to Uttar Pradesh government data, 14 people died of Covid on April 14th in Lucknow. India Today visited two main cremation grounds of the city to conduct a reality check.
कल 72 के।
अच्छा, उससे पहले?
उसके पहले आपका 52 के अप्रॉक्स है।
यानी कि 14 तारीख
58 to 52 है। 12 तारीख को आपकी जो है 52 है।
12 तारीख को दिखा रहा है। ये कितने हैं? 14 तारीख
33। 13 तारीख को 35 हैं, फिर 12 को 33 हैं।
तो ये वो संख्या है जो यहाँ पे अंतिम संस्कार हुए।
अंतिम संस्कार होने की संख्या है ये। इसमें
सरकार की तरफ जो आंकड़ा आता है उसमें हर रोज बहुत कम दिखाया जाता है।
नहीं, तो उसमें कम इसलिए दिखाया जाता है कि बाहर की भी बॉडियां आ रही हैं ना।
If 72 bodies were cremated at Vaikunth Dham and 33 at Dulala Ghat cremation grounds as per records, it adds up to 105 deaths in Lucknow alone. This as the UP government reported 68 deaths across the state on April 14th. India Today confronted the UP government about the alleged discrepancies in the official death figures.
लखनऊ में दूसरे जनपदों से भी मरीज आते हैं, उनका रिकॉर्ड उस जिले में रखा जाता है, और लखनऊ में शमशान घाट में दूसरे जिलों से भी आसपास के लोग भी यहाँ पर अपना अंतिम कर्मकांड करने आते हैं। सरकार कतई किसी प्रकार से कोई भी मरीज या कोई भी डेथ नहीं छुपाएगी और नहीं छुपाना चाहती।
The opposition is in no mood to buy this argument.
मुझे तो समझ में नहीं आती आखिर सरकार छुपाना क्यों चाहती है। शमशान के डाटा कुछ और कह रहे हैं, सरकार कुछ और डाटा दे रही है। सरकार कम डाटा दे रही है, शमशान के डाटा ज़्यादा हैं, कई गुने ज़्यादा हैं। आखिर सरकार छुपाने की कोशिश क्यों कर रही है? कोविड 1 साल से यहाँ पे आया हुआ है और आपने कहते हैं टीम 11 यहाँ काम कर रही है। कहाँ टीम 11 है? कौन सा काम किया है जो पूरे उत्तर प्रदेश को टीम 11 ने हरा दिया?
The shortage of beds in hospitals and the increase in cremations have raised questions about the government claims about the pandemic. While the opposition is targeting the state government, the administration is yet to give a concrete answer to the charges leveled against it. With Shivendra Srivastava in Lucknow, Bureau Report, India Today.
Let me take this across now to Abhishek Mishra, who's joining us live from Lucknow. Abhishek, the numbers that are coming in from Uttar Pradesh is very worrying. And also what's clear is that the infrastructure is not ready, is not capable of dealing with this kind of caseload, with this kind of case rise that's being reported in Uttar Pradesh. What are the next steps that the Yogi government is contemplating? Is there a possibility of us seeing a weekend curfew or even a complete lockdown like in Maharashtra?
Well, Akshita, that looks like the urgent need for the Uttar Pradesh government to at least come up with weekend lockdown. We have seen in the past couple of days the kind of cases which are coming rapidly. Numbers are making new records day by day. If I talk about 24 hours, 22,439 cases have been recorded and 5,100 only in Lucknow. And also on the other hand, the situation in hospitals as far as beds are concerned, testing of migrants, and also at the same time, you have just seen the report of the cremation ground, what is actually happening. So all these things come together with the conclusion where the government really have to think over putting the lockdown at least in the weekends, or have some more restrictions. Although they have increased the night curfew timings from night 8 p.m. to morning 7 a.m. There are several restrictions also at the public places, the big monuments, and every other place is closed now. But that not look satisfactory at the moment. They really need a more wide, strict action against these cases until it's too late.
Okay.
Yes.
All right, we'll be tracking the decisions taken by the Yogi government and the latest numbers that are coming in. But clearly, Uttar Pradesh also, there is a rapid rise in cases, which is very worrying and something that must be addressed at the earliest. Abhishek, thank you for joining us with those details. Breaking news that's coming in now.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.